While it takes an investment of time, focusing more on understanding the patient's needs and the provider's understanding of therapies rather than just making a simple change, but really understanding what are you going to do next? What are your eating and exercise habits? What are the things in your life that may be impacting your ability to care for your diabetes? So time alone is not going to solve this problem, but really deeper understanding of what's going on. I use the analogy of saving money. I think many of us say, gosh, I could save more, but in the moment, picking up that extra slice of pizza or buying something for a child may be compelling. So stepping back and saying, how can I change behavior, in this case for diabetes management? In this study we were looking at adults. I think trying to expand that understanding, and we will continue to do analyses of these data to look at age groups, to look at specific geographic regions of the world. This was 18 countries across the world, so we'll have a chance to understand what may happen in East Asia, South Asia, Europe, and the Americas in more detail. For us, communication of the scientific information is key, and to do so in any 1 or 6 presentations could be limiting. I'll harken back to the presentation by the President of Medicine and Science, Des Schatz, this morning. Diabetes remains a problem that is still wholly unsolved. There remains an epidemic of diabetes, mostly driven by type 2 diabetes, and with the number of individuals affected by diabetes growing around the world, and the care of diabetes coming under more and more pressure, as you suggested, with time, with resources, and with the choices of therapy. Continuing to explore the best avenues or opportunities for improving care is really part and parcel of these presentations. Again, I'll harken back to the presidential lecture. There are other chronic diseases, heart disease, where we've seen a remarkable decline in death from cardiovascular disease. The rates of death from cancer are declining by 1% to 2% per year. Management of chronic conditions like HIV/AIDS have improved substantially. So there remain opportunities, and diabetes and other chronic diseases are really at the forefront of hopefully being the next where these advances occur. Diabetes is a condition where the primary care provider, the support system in a clinical care setting, cardiologists, endocrinologists really do need to come together. The vast majority of patients in the U.S. with diabetes are cared for within the primary care setting, and that's really chronic disease management, not just diabetes management, managing their blood pressure, managing cholesterol, managing any lifestyle changes that may ultimately be necessary. So it will take a village, in a sense, to manage diabetes, and we hope we can bring the information forward that helps that village do so most effectively.